Welcome, everyone. Thank you for joining our Clinical View series on thriving as a flexible health system. I'm Matt Smith with GE Healthcare, and I'm excited to be hosting this panel discussion today. This session will focus on the shift toward the acuity-adaptable model of care, what it is, how it supports the movement toward flexibility, and why some hospitals are considering it and even adopting it. But before we dig in, let's start with a brief round of introductions with our panel. Can each of you please start by sharing a little bit about your background and current positions? Let's start with Faye, then we'll continue with Corey and Brandon.
Thanks, Matt. I'm Faye Aebly. I'm the Clinical Development Manager for GE Healthcare Patient Monitoring. I'm also a CVICU staff nurse at St. Luke's Medical Center in Milwaukee, Wisconsin. I am the clinical voice into our new product development, ensuring that our products meet clinical expectation and are integrated seamlessly into clinical workflow.
Thanks, Matt. My name is Corey Gaarde. I'm a principal with IMEG. I oversee our healthcare information technology advisory services practice. By doing that, I strategically lead a team of healthcare IT professionals advancing the role of technology in the future of healthcare facility design. In this role, I help ensure kind of a comprehensive, collaborative, and connected care technology considerations focused on a patient and caregiver experience at the earliest stages of the engineering design process and subsequently throughout.
All right, thanks, Corey. Brandon Henak. I'm the executive director for the monitoring solutions business for marketing. I get a chance to work between our product management teams and customers, like many of those that are listening today, to make sure that we fully understand in depth the needs that you have for monitoring solutions in the hospital, and make sure that we translate those into the products that we're releasing every day. So excited to be here. Excited to talk a little bit about Acuity Adaptable Solutions.
That's great. Well, thank you all for joining us today. Now let's dive into the discussion. So Brandon, let's kick it off with you. Can you start off with an overview of what it means to you when we hear the terms acuity adaptable care and acuity adaptable units? I know that there's multiple relevant applications and unique components to each.
This concept really has been around for over 20 years. Institutions looked at the transport process of moving a patient around an institution, and there's many side effects that can happen through transport. There's a lot of risk involved. They wanted to reduce that risk and keep patients in one area throughout their care continuum. Now that requires a significant amount of effort to make sure that you're able to scale those capabilities within a single space, both monitoring, therapy, diagnostics. All of these things have to shift up and down. But institutions wanted to be able to do that to manage patient populations and manage those transports throughout the institution. Now, that acuity adaptable model started to morph during COVID, both because it had benefits for isolation, cleaning, sterilization, those types of things that were extremely important then. But it also reflected in the fact that institutions wanted to be able to flex certain areas of the institution because of those needs being increased during COVID. So many institutions shut down ORs and scaled up their ventilated ICU capabilities, brought in more patients in ER and med-surg spaces. So they needed to be able to flex and move their capabilities throughout the institution so that they could respond to major changes in demographics and to the pandemic itself. So this has been a huge change that's happened over time. It has had effects on the nursing population and the patient population as a whole, but it was born both of the necessity of reducing the risk of transport and managing patient populations, and it only accelerated during the COVID pandemic.
Great, thanks, Brandon. So Faye, let's turn it to you. Brandon just mentioned that the concept of adaptable care models were to some degree given new life out of the necessity to manage COVID. So to that end, what did we learn about this model in recent years, and why are we continuing this evaluation even though we've largely navigated the pandemic?
Yeah, I think it's no secret that our healthcare systems are really strained right now by limited resources and increasing costs. The COVID pandemic certainly challenged the system, but there are other surges that go on beyond the pandemic that we really could use this type of model with. For example, RSV, mass trauma. We have seasonal impacts of chronic diseases such as COPD exacerbations. So there needs to be there doesn't need to be really a once in a lifetime pandemic to say that we should use acuity adaptable care. Rather, I think that healthcare needs to be flexible overall. and be able to adjust themselves when they need to use this type of a care model. As Brandon mentioned, the acuity adaptable care model has really been around for 20 years. COVID just showcased the need and some of the benefits. There are also other benefits to using this type of a use case model. For example, the Center for Health Design did a review of 6 hospitals and their lessons learned. They were facilities that used acuity adaptable care, and they found that clinical workflow efficiencies were realized. For example, quicker response times to patient condition changes. There were more efficient staffing assignments that could be done with limited resources. And the risk of having medication errors, patient falls, or even gaps in communication when the patient is transferred multiple times, those risks increase. So when you have the acuity adaptable care, and you're really changing the environment around the patient, a lot of those risks decrease. There also is, with less resources, we have challenges around bed availability. So the acuity adaptable care units have been shown to have decreased length of stays. We have decreased infection rates, decrease in medical complications that can arise as those patients are transferred from unit to unit. And then the benefit around that is really controlling that cost, which we see rising. But as the nurse, I feel like one of the biggest benefits for me is that the nurse-patient relationship also improves because you're building more trust. You have more time with that patient and family, and as a result of that, you're really going to see that patient satisfaction score goes up.
So Faye, a follow-up question for you. You mentioned some staffing challenges. Can you elaborate a little bit more on those, the ones that you just referenced?
Yeah, so typically nurses, when they're hired into hospitals, are actually hired for a specific unit and a specific patient disease type. What we're doing when we look at acuity adaptable units is we're actually asking those staff members to manage patients from low acuity to high acuity and at a moment's notice. So that can present a challenge with nurses. You have to have nurses that are accepting of that workflow and be flexible in an ever-changing environment, which can be a challenge when you're trying to maintain that skill level in a nurse that's high acuity and then flexing to a low acuity has a different skill level and vice versa. So I think that that's probably where we run into some of those challenges from a staffing perspective.
So let's bring in Corey. Corey, you and your team at IMEG regularly work with hospitals implementing new acuity adaptable programs. So first, maybe you can tell us a little bit more about how IMEG partners with hospitals developing these. And then second, to build off of this and the point that Faye just made regarding a hospital's ability to accommodate across acuity needs, how are hospitals addressing this challenge?
Yeah, there's a lot there to unpack from Faye, but ultimately it understands right at the forefront of the range of clinical and operational use is actually key to success. IMEG as a whole will challenge us to be sure that the functional range can be accommodated in the futures as needs changes. With COVID, we saw a dramatic change in just operations, and we have to have to consider space and room configuration from an architectural perspective, HVAC systems design parameters, quantity and types of med gas outlets, oxygen, vac, med air, waste, anesthesia gas, etc. And then quantity and type of electrical, normal and emergency systems in the particular room. Technology is so paramount these days, and medical equipment infrastructure to support current and potential needs in the future, balanced between hardwired and wireless. There was a lot of great innovative things, but how can we, from a future perspective, really build and incorporate some of these outcomes accordingly? HVAC supply is critical. It sounds simple in theory, but it's managing how we design air handling and exhaust to really fully function on a normal operations versus acute adaptable instance. There's also been looking at potential anti-rooms and how many locations associated with each patient rooms. The key point there, though, is systems need to be designed to function across the full range of use without sacrificing efficiency and code required operations. Again, not all areas need to be acuity adaptable to serve the full range of acuity levels, just as Faye outlined. But ultimately, focusing that initial experiences and where acuity adaptability is most needed is a very critical approach to success.
Great, thanks, Corey. Well, that brings us to the end of our session today. So thank you very much to our panelists for sharing your observations and insights that come from supporting this reemergence of adaptable acuity care. I think it's clear that our learnings come out of this pandemic, along with the current pressures in healthcare, really make for a very appropriate time to reevaluate innovative care models. Thank you to our viewers for joining us today, and please join us for our next panel discussion where we'll continue the conversation on thriving as a flexible healthcare system.